Hello everyone, and konnichiwa minasan. Today I will be comparing the American healthcare system to the Japanese healthcare system. First and foremost, on a cultural level, governmental level, these two nations could not be more different. Um, America is a forward-thinking nation. They tend to be a individualistic society. Japan is steeped in tradition, very much collectivist society, and I think the laws that they create are very much based on these norms. So to start off, the different types of insurance are very similar in Japan and in the US, mostly in the fact that private insurance is available in most countries. The main difference is that the national insurance is provided to everybody in Japan, and the private insurance can be purchased as an optional add-on if one so chooses. We're in America, for the most part, we're run by private insurance. Things have changed recently with the Affordable Care Act, of course, and we have insurances through businesses and things like that. But still, for the most part, it's very much privatized, and even the insurance you get through the Affordable Care Act marketplace is done so through subsidization by the government to private companies still. Whereas in Japan, it's an actual government run, and they call their government the Diet in Japan. It's government run, government controlled. That's one of the main differences. So cost control. As we learned, there was a big effort to control costs in America through the use of managed care plans. This, of course, put power still into the hands of the companies. They still made those decisions. In Japan, it could not be simpler. Cost is 100% controlled by the government. Okay? There is a committee that regularly reviews how much things should cost, and they basically say this is what they're going to cost. Very simple. Most people in Japan, they know if you were to go ask somebody and say how much does this cost, they would more than likely be able to tell you, because the costs are relatively the same, and they have remained the same, obviously going up or down depending on inflation, things like that. But in America, I couldn't even tell you what my doctor's visit is going to be from year to year, because these things change. There's so many stories in America about people getting itemized lists from their hospitals and seeing that a steel screw costs $2,000 per screw. But then you can call and you can complain and you can get it changed and you can get it covered. It's just so very confusing. And a lot of times you have to fight for your health care and fight for your coverage. It's not that way in Japan. Everything is laid out very simple, very easy to understand. So finance. So the GDP in Japan is nowhere near as high as it is in America. But interestingly enough, the money spent per person in Japan is less than half in the US for healthcare. But still, the citizens in Japan are healthier, happier, and they live longer. And the number of citizens in Japan, interestingly, that are above the age of 60, percent-wise, is almost double that of America. So the citizens are living longer, and as people live longer, they have more healthcare needs, yet Japan is still able to keep up with all of these needs by doing national insurance plan. So the overall availability in Japan is also very great. It's very comparable to America, but whether or not you can utilize these things is based on insurance, where, as I've mentioned before, in Japan, insurance is universal, and pretty much wherever you go, you know you're going to be seen. And this has a profound effect on cost. As I've mentioned, the GDP being lower, yet the cost per citizen for healthcare being half that of the United States, if not lower. And technology too. Technology is a very large part of healthcare. Is it available? Is it working? Does that cost get pushed on to the person getting the healthcare? If you go and get an X-ray in a certain place and they have a $10 million X-ray machine, is that going to get passed along to the consumer? Well, it very well can in America. In Japan, it won't be, because all these prices are set. Now, interestingly enough, some of the rural healthcare clinics in Japan are actually better equipped than the ones in the cities. And this is because of the way that Japan allocates their money to make sure that those rural cities are not left behind. They oftentimes end up getting better technology. And part of the reason for that is because in a rural area, there might be only one clinic for 20 miles, whereas in a city, there's clinics everywhere. So you have to make sure that when you go to that place, they have the technology. Unfortunately, it's not that way in America because it is so much controlled by how much the company can make. So when you go to a rural clinic out in the middle of nowhere in America, you're not likely going to get the best care. If you want the best care, you have to go to a city. And some people drive miles and miles to get health care, cardiologists, specialists, stuff like that in the city. And that's just not convenient for anybody. So as I've mentioned, the geographical spread of the clinics is about the same as in America. However, there are differences in how people get around. Okay? There's not a huge difference in the number of people, percentage-wise, who own a car in Japan versus America, but there is a robust public transportation system available in Japan that is cost-effective and is available for pretty much anybody. You also can call an ambulance with ease in Japan without having to worry about a massive medical bill. Okay, so that absolutely helps. In Japan and in America, welfare works a little different. It is a little easier to get in America, same with disability, but when you do get it in Japan, it's great. It covers just about everything. And one of the issues is that in Japan there is still the stigma on disability. Not every single one of the workplaces, for example, are required to do these hires. So when you can't get hired, you can't work. Then you have to get disability, which also then can be hard. So they don't have as robust law as we do with the ADA, with buildings being accommodated for everybody. So people do fall by the wayside sometimes, but at a much lower rate than they would in America. So mental health has been a stigma basically anywhere in the world. It's been getting much better overall. Japan has not been doing this as quickly as we have. Like I said, they're a very collectivist society. When you don't work, you don't contribute. And it can be seen as a bad thing. People don't want to talk about mental health. They don't want to, deal with any of that stuff. You got to keep your head down, keep the problems to yourself. As this has become more accepted, especially through media, people making posts on social media, movies and stuff, presenting characters who have mental health problems, and it's become a lot more accepted. As time goes on, it's going to become more accepted. So the overall quality of care, of course, is better in Japan per person. Better health outcomes, longer life expectancy, healthier citizens, even though we spend about twice as much as them. Now, this begs the question of why. Why is this happening? So in America, there's personal freedoms, and they're very, very important. We have programs through jobs that encourage people to exercise, stuff like that, quit smoking. In Japan, there's actually a Metabo law, which if you get to a certain body mass index, or an employer has a large number of employees with a high body mass index, they will be required to do educational classes or required to pay more. Okay, this might not fly in America as an actual law. As a suggestion, absolutely, not as an actual law. That's part of how they keep costs low. Again, there's also a lot of social stigmas about being overweight and that you're lazy and that you don't work. So there's a chicken or the egg argument. Is Japan's healthcare great because the citizens are all healthy, or are the citizens all healthy because the wealth or because the insurance is great? I personally believe because of the culture, it starts with individual responsibility, and that is what has allowed the system to work so easily so far. So these two countries, again, could not be different, much more different, and this is probably why the healthcare systems work so differently. In a lot of my research, I haven't seen anything that suggests that the size of the population or the size of the country is necessarily what's causing it, but it's overall a social and ethical, ideological difference within these two cultures based on when they started, what ideals they started as, and where these laws came from. I'm hoping that eventually America can adopt some of these policies because they're working very well in Japan. Thank you very much.